Hello, this is Corey Drinkett. We're going to go over the next 410 sets of instruments. The first one is the Bosman um, sponge forceps. This is mainly used in your gynecology or GYN um, specialties. It's really just to grasp and hold mainly sponges and gauzes and put it into the vaginal air area. This is a Babcock. It does come in two different lengths. It is really used to grasp on and to hold very soft tissue, mainly mainly like tubes or bowel veins, fallopian tubes, stuff like that. So it's used in an array of procedures. Uh, this is the Rochester Carmelot forceps. We just really just call it a Carmelot. It does come in two different lengths. It is really used in a lot of your abdominal cases for grasping small organs or soft tissue. This is a Rogers wire scissors, or we just call it a wire scissor, and that's what as the name implies, it cuts wire. So it'll cut um, your K wires, which is a very small, thin wire used in orthopedics when they put bone together with some type of wire. This is an operating scissor. It's also known as either nurse scissors or a suture scissor. It does come in different lengths. It comes in curved and straight. You got to be careful because it comes in three different styles as well. Um, it's it comes either a blunt, so that the tips are going to be more curved, so there's no sharpness to it. There's a one called I call it a 1 point sharp, to where there's one tip that is beveled, so it's not sharp, and the other one is sharp. And the third style is what's called a sharp, where both ends are very sharp. This is a Richardson appendiceal retractor. We just call it the appendiceal retractor. Comes in one length. It is part of the Richardson family. It is to when they cut open the patient, it's used to retract that soft tissue so they can get to the appendix. So the blade is going to be longer than your regular Richardson. This is the Metzabom scissor. They do come in different lengths. They are thinner than the Mayo scissors. They do come in stainless steel. They come in with the tungsten carbide, which will have the gold handle, or they will come in as also a supercut, which is a black handle. They also do come in curved and straight. They are used to cut and dissect delicate 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 tissue. So something soft, like bowel, um, very soft, fatty tissue stuff like that. This is the Rochester Ochsner four-step. We just call it a coker. Um, it, it comes in different lengths. The most important way to recognize that it is a coker is that the very tip on both ends will have teeth. So be careful of that. So it kind of will look like your peon forceps, but with the coker, it's going to have teeth at the end, serrations all the way down. They do come in curved and straight. It is used to manipulate heavy tissue, muscle, heavy fat, stuff like that. Last one is the probe and groove director. Um, it comes in different lengths, and then it's just to explore or gauge the depth of um, whatever that they are doing. It's used in a lot of IND cases, which is incision and drainage cases. So it's just a probe to see what the depth of whatever they're working on, how deep it is. There's also one. It's a groove director. So it's going to have a groove going down the middle. They can use that to when they need to cut. They can take scissors and go along that groove and just cut along that.